Mounjaro is a novel dual GIP and GLP-1 receptor agonist. This medication helps reduce excessive glucose production by the liver, lowers food intake, and slows gastric emptying. It is used in adults for blood sugar control in type 2 diabetes, and is also being studied for weight management. As for appearance, Mounjaro comes as a prefilled injection pen containing a clear, colorless to pale yellow solution. Each pen consists of a cap and the pen body. The pen body includes pen tip, the cartridge holder, plunger, dose indicator with window, and the dose knob. As for dosage, Taipei Medical University provides two options: a 20 mg pen delivering 5 mg per dose, and a 40 mg pen delivering 10 mg per dose. Dosing is personalized. Always follow your doctor's instructions. Inject once weekly. It can be administered at any time of the day. Before injection, recommended injection sites include the abdomen, at least 1 fist width away from the navel, the outer upper arm, namely the triceps area, the outer front thigh. We suggest rotating injection sites or a different spot within the same area each time. Prepare the following before injection: alcohol prep pad, new sterile needle, and a sharps disposal container. Wash your hands thoroughly. Now you can start. Remove the pen cap. Check the pen for any damage. Make sure the name, dose, and expiration date are correct. The medication should be clear and colorless to pale yellow. Do not use it if you see particles, cloudiness, or discoloration. Wipe the pen tip with an alcohol pad in one direction. Peel off the needle seal. Attach the needle straight onto the pen and twist it clockwise until tight. Remove the outer needle cap and keep it for later. Remove the inner cap and discard it. Now we'll prime the pen to remove air. Turn the dose knob until you hear 2 clicks and see a long line in the window. Hold the pen with the needle pointing up. Tap the cartridge gently to bring air bubbles to the top. Press the injection button all the way down. If a small drop appears at the needle tip and the window shows 0, priming is complete. If no drop appears, repeat the process. Next, prepare for injection. Select one of the injection sites mentioned above and clean it using an alcohol swab in a circular motion from the center outward. Turn the dose knob until the window shows 1. This indicates a full dose. A full dose equals 60 clicks. If instructed to take a half dose, turn 30 clicks and mark the spot for future reference. Insert the needle straight into the skin. Press the injection button all the way down. The window should show 0. Hold the needle under the skin for 5 seconds. Afterward, remove the needle from your skin. A small drop at the tip is normal and won't affect your treatment. If medication leaks out, try holding for a longer time next time. Use one hand to replace the outer needle cap and unscrew the needle counterclockwise. Dispose of the needle in a sharps container. Replace the cap on the injection pen. Storage and precautions. Before first use, store in a refrigerator at 2 to 8 degrees Celsius. Do not freeze. After opening, store at room temperature below 30 degrees Celsius for up to 30 days. After use, always replace the cap to protect from light. Sharps container should be puncture-resistant, sealed, and clearly labeled. Return them to a medical facility for disposal. If you miss a dose, Take it as soon as possible within 4 days. You can change your injection day if needed, but there must be at least 3 days between doses. Once a new day is chosen, stick to a weekly schedule from then on. Possible side effects: you may experience nausea, vomiting, or diarrhea. These can often be relieved by eating small, frequent meals, avoiding greasy foods, and staying hydrated. This medication has a low risk of causing low blood sugar by itself, but combining it with insulin or other diabetes medications may increase that risk.